Okay, hello again. Welcome to our panel about telemedicine, the technology that not only changes our lives, it actually saves lives. I'm here with three distinguished panelists, Manuel Vexler, the CMO of NGN from Huawei, Nupur Srivastava from Cisco, who is heading the healthcare vertical in the Telepresence group. And also on audio, we have Richard Millendorf, the head of business development for e-health and machine-to-machine communication in Orange Healthcare. First of all, I'd like to say thank you, everybody, for making the time and joining the 2025 virtual conference that happens everywhere, a global event. Unlike the previous panel, all of you guys are located in the same continent, so it's not as cool, but still, at least you're not in the same room. Manuel, just to give context to our viewers, how does your company change the telemedicine field today?
The main applications we're working today are really related to HD conferencing and HD video. We see a lot of applications in that vertical. We're working with hospitals directly, as well as we work with service providers in the region. I'm working in the Latin America and North Latin America region. We're working with carriers to provide the services on demand. If you know a little bit about this region, it is the level of population is high, but the level of services is pretty low. So telemedicine plays a very strong role in both emergency care and maintenance care.
That's extremely interesting. So you're providing some of the infrastructure required, basically, for telemedicine services.
Correct. That's true. We combine some of the features also with cloud computing and other services we can offer to the service providers. As you know, medicine creates huge amounts of data using extremely large amounts of high-quality pictures. So the storage, the retrieval systems are also very important.
That's extremely interesting. And Nupur, how does Cisco Telepresence Group plays a role in the telemedicine field today?
Yeah, so the healthcare vertical is a really important vertical within our Telepresence group. Telemedicine is a very fast-growing field. Cisco plays in various areas of telemedicine. So we provide the endpoints, the video technology that's needed to have a successful telemedicine encounter. A lot of the infrastructure that's fairly important too. In addition to that, there's various sectors that we play in within healthcare that makes a successful telemedicine encounter. So computing, this is something we're just beginning to scratch the surface of, but it's very important to have a good encounter that way. As video capabilities are going to advance, clouds are going to help create a much more connected environment. Of course, we work with video endpoints that are very healthcare centric. So there'll be video technologies that work well in healthcare environments that we attach various medical peripherals to. We also work with various partners in the healthcare ecosystem to make sure that when we actually deliver a telemedicine encounter, it fits within the workflows of clinicians, something that's fairly important in the sector.
It's fascinating. And Richard, how does your company support the telemedicine revolution?
Sure. So what Orange does, it looks at the full ecosystem of the healthcare and telemedicine. And what does that mean? We look at from developing the applications and firmware for medical device companies, helping them in that fashion, to delivering and connecting those devices with our machine-to-machine practice, which is roughly about 170 countries globally, using enrollment partners and everything through that, using a single contract with Orange, as well as hosting the solution and making the patients be able to access that data, creating applications for the medical device companies or service providers, hosting that data, looking at it from a global regulation point of view, making sure each country's regulations are met. That is where Orange focuses on using partnering with medical device companies itself.
Okay. So basically, we have here around our virtual table almost the whole value chain of telemedicine. And you know, I have to admit I'm a bit confused. Everybody were talking when I was, reading the first content about telemedicine. It was always how do we bring in remote brain surgeons to help someone else, a surgeon in another location, to do a very complex operation. And then I saw a product by one of our clients, and also there are competing products, which is basically a very small box that you can put close to your heart, and it provides hospital-grade ECG reading, a very high-end device that is costs several $100s, and it connects to your iPhone or I don't want anyone to believe that I'm pro iOS, so you can connect it either to your iPhone or Android device and send a full reading to your doctor, right? And if we're going to have these kind of devices more and more in the market, how will it affect the healthcare system? How will it affect the role of a hospital, in your opinion, 10 or 15 years from now? Manuel.
So the accent, actually, the emphasis in medicine now is toward prevention, and it is very important actually to collect this data real time, ECG, EEG, in case of a brain attack. So the technology will evolve to the point where when the vital signs are starting to change, the doctor will be alerted and can intervene before a major catastrophic events happen. And I think this is a very clear trend, as you said, that's tied into both the devices which are capable to collect data, as well as the transmission part, which will be a mobile device of some sort.
Nupur, how do you see this thing happening in the market?
Yeah, so I think, what we see happening is really interesting, right? So your cell phone can be a monitoring device. You have glucometers, and I think most recently I saw even an otoscope that's just an attachment to your cell phone device, right? So I think things like this are good because, if anything, it brings down the cost a little bit because people can do a lot of monitoring when they're in their home. And I actually think it maybe potentially even, increases the access to healthcare because you're not always having to go to a doctor. I think, as Manuel said, this will probably emphasize the preventative side of medicine too, right? I think in the future, 10 to 15 years, wearable sensors of sorts will be, very common. These sensors should be able to detect very few changes in, your body and be able to detect oncoming, issues that you might be having. And in terms of, the way I also see encounters going in the future, 10 to 15 years, hopefully even sooner, is that I think patients should have access to their doctors from home through video. And this doesn't have to be, a very expensive telepresence room. It can be on whatever device they have, right? Like through your iPad or through your laptop or through even this type of client that we're using. We hope that it's fairly easy for a patient while sitting at home to be able to access, a bunch of doctors, who knows, maybe in a call center somewhere. So I think a lot of interesting things are going to happen here, and I'm glad things are moving that way, right? It's lower cost, it's higher quality, more access. And I actually hope that the world gets there sooner than 10 to 15 years.
And Richard, how do you see this point?
Well, I think it's happening already. I mean, we have customers of ours that are connecting patients from the home, transmitting that data into a hub where the doctors could access their medical data, whether that's a cardiac device unit, a defibrillator, a pacemaker, a sleep apnea device type of service, where there's twofold. One, the doctor would like to see the data in more real time and more proactive versus reactive modes, as well as the insurers are asking to make sure that the prescribed device in sleep apnea, for instance, is actually being utilized before it gets reimbursement. So there's twofold. There's obviously helping the patient get more care from the doctor. It's also for the payers to ensure that the patient's actually using the service that's been prescribed before they reimburse. And that's what we're seeing today through medical device companies throughout the globe, not only in the U.S. as well as Europe.
That's pretty fascinating. And one of the things that we have, we're working with a company called Treato, and they have a very, excuse me, they have a very interesting product, which is basically a search engine where you can search for the side effects of medication that you are taking. And it's based on the buzz in the internet about the voice of the patients, right? And my dad is way over 70, and he didn't feel well, so I was going to the search engine. I was start to look to the different kind of side effects, and then I told him, well, you know what? Maybe you are taking. Are you taking this and that drugs? He said yes, because he has a heart disease. And then we were able to go together to his doctor and tell him, well, thank you very much for this medicine, but it doesn't work well for my father, and we need to do something else. And I think that all these technologies are changing the balance between doctors and patients. There is a TV show called Deadwood, and one of the only guys in the TV show that is that is able to stand up to the big bad guy is the town's doctor, because everybody needs them, right? And they know things that no one else knows. But when you look at the way that people communicate today and the amount of data they have and the amount of insight they have when they go to visit their doctor, it's a completely different situation. And it was for sure in Deadwood, but also 20 years ago. How do you see the technologies that you are talking about? How do you think these technologies will change the balance between doctors and patients? Will we see patients that are more educated, or will we see at the end of the day still a huge gap between the ability of a patient to really evaluate the opinion that the doctor gave them, as it still exists in some cases today? Manuel, how do you see it?
So first thing, we should separate education from self-treatment, because that's dangerous. But I foresee M2M technologies being able to measure. Our body gives a lot of data out. So medicine, it is known in pharmacology, for instance, that medicine has to be the dose of medicine has to be done accordingly to the patient. In general, the tests are done on mature male adults, and that doesn't apply, for instance, to females, which have a different biochemistry. Doesn't apply to old people or young people. So I think by constantly reading the output from our body in terms of, and I'm talking non-invasive. I'm not predicting that people will have to take blood samples every 15 minutes or so. But we have an electrical representation of our body. We have a biochemical representation, which M2M can sense it. This information can help you get the right dosage of medicine, hence keep you healthy longer. And again, you can see something out of balance very quickly. The science is already there. Doctors know how to read it, but today you get maybe a blood sample or a sample from your body every 6 months or a year if you're healthy. And I foresee that happening at least once a day, which gives you a much better signature of your health. And of course, this connects back to the backhaul systems, mobile and so on, which will be the communications infrastructure. Your favorite iPod, by the way. So it's M2M to iPod, collecting biological data about everybody, and where there is a sign of stress, raising an alarm or sending an email to the doctor.
Nupur, how do you see this balance changing in the future?
Yeah, so the way I see the doctor-patient relationship, I don't think that'll ever get replaced. I think if any technology will make that encounter more useful, if that makes sense. So I think there are some fairly scary stats. So by 2020, I think there's going to be a shortage of 90,000 physicians in the world, right? So if you look at those type of numbers, I think technology is almost needed to make the encounters that a doctor and patient have as useful as possible, right? So that if the patient comes in with a plethora of data in terms of how they're doing, all sorts of digital data, I think that, will make the limited time that the doctor and patient have more useful. I think we're seeing some interesting things already. So if you look at telemedicine encounters right now, video-based encounters in telepsych, in issues where, there's mental issues with patients, and we see this in the VA a lot. We're sometimes seeing that these technologies are enabling a better relationship between patients and doctors, because patients can do a lot of these encounters from the comfort of their own home. And sometimes they're moved to reveal more things, or the doctor can almost pick up more cues in terms of the patient's environment if they have that small insight into the window of their home, which is really fascinating. And we've heard things like self-view, when a doctor is in a video conference, helps the doctor adjust, their posture and the way that they're coming across to the patient better, which is, really great. And, it's one sector where I think things like video conferencing, things like telemedicine are so useful, right? Just to let doctors scale their time by time to be more effective in the short encounters that they tend to have with patients. So yeah, that's sort of my take.
Richard, what is your vision? And if you can speak a bit stronger, it will be good, because all the other guys here have those fiber to the home and these cool technologies, so we can hear them a bit better.
Sure. Can you hear me now? Is that okay?
Yes.
Okay, great.
Yeah.
So where we see, we see the patients getting smarter or more, interested in their care than in the past. And that's good and bad. But to your point before, we need to ensure that they still get care and they're not trying to self-fix their issues that they're having, right? Self-diagnose. But we are seeing in a lot of our customers and in the industry, and a lot of the market is that they could not see the doctor as often physically, while the medical data through machine-to-machine and other technologies are collecting their vitals. If you look at glucose monitoring, it could be, continuous monitoring is what they call it. So it's not just every few hours you take your insulin. It's continuously being monitored. It's captured in a platform, in some sort of application where the doctor could see it, so they could proactively see how the patient's feeling. But at the end of the day, they still are communicating to the doctor. It just may not be physically. You see that in cardiac care. Instead of seeing the doctor 8 times a year, with cardiac remote monitoring, they say they could see the doctor once a year. The doctor's still looking at you, still monitoring you, but physically, especially for the elderly, they don't have to physically get to a doctor for them to be viewed. So we see a lot of more portals out there where people want to be educated on their disease. They also want to see a lot more of their medical records. So the EMRs and visibility into the EMRs is becoming more popular in the industry.
Well, we're all talking about all this constant monitoring, right? We're talking about the ability to take a huge amount of data and send it through the wire across the globe. But what about privacy? We're talking about a way that we will be able all the time, from morning till night, to have our health situation recorded in a way that is much more easier to duplicate. And we all know that there is there is no solution for hackers, right? When there's no such thing as a safe storage. What about privacy? How do you see, in your opinion, the level of privacy that companies and organizations will be able to provide to those who are using your technologies? Nupur?
I think privacy in healthcare comes up all the time, and it's just I think the technology can take care of it. I mean, there's ways to monitor things through wirelessly in a way that is very secure, and it's done right now already in a fairly secure manner. And you could always, it's not like the data goes and sits in a public cloud, right? You could always secure the private cloud that the data is on, and I think it's unfortunately, I hope it doesn't become an issue that detracts how fast we move in healthcare, right? There are a lot of concerns here, but I think with the right technology, you keep bank data private, right? Look at online banking, that's kept private somehow. I don't see why healthcare can't sort of get there. And I know that there's a lot of fear from a consumer point, and we hear interesting things from doctors. They say things like their patients want to keep their data so secure, but the moment they have it, it's okay if the patients go post it on Facebook, but they don't want the doctors doing anything with the data. And I think that's a fair concern. That being said, I think the direction technology is going right now, the way data centers are made secure, the way the backhaul is going, I think it's fairly possible to do this in a very secure manner, and I don't think that should be a detriment to how fast this moves.
Manuel, what is your point? What is your point of view?
I think in terms of general security of data, as Nupur has said, we do have technologies for encryption, technologies for storage. I don't see that a higher risk, let's say, than banking data or other data. My concern is more coming into the way this data is used after it's decrypted. So, for instance, think of insurance companies which will deny you care because your grandfather had this genetic disease. And these kind of things are at this point in time need to be carefully considered from a regulatory and legislative viewpoint. I think the legislation will change dramatically. In terms, going back to data security, I think will continue to improve, but it's a very difficult gamble. As you said, the hacker has to break in once. We have to protect huge volumes of data in real time from any possible hacking. But I don't think there is a particular problem with medical data. My concern is how this data is eventually used and potentially used against the patient, against the well-being of the patient, physical or mental.
Mm-hmm. Mm-hmm. I believe that probably one of the biggest beneficiaries of this whole process will be the insurance companies, that they will have everything.
Hopefully beneficiary in a positive way, right?
Well, that's another discussion for the panel, the future of insurance companies. Richard, how do you see this the topic of privacy, especially when you have a rise of machine-to-machine communication that generates a lot of content that at the end of the day is still private?
Yeah, I mean, I agree with my colleagues. I mean, the fear of the data should not be, should not stop the progress of technology. And what does that mean? I mean, there's data privacy laws, there's HIPAA in the U.S., there's, what we call ASIP in France, and there's each country has its own unique data privacy laws, which has to be followed by the medical device companies and service providers. But from that point, I guess to my colleague's point before, what are they going to do with the medical data once they get it, right? I'd be much more concerned about ATM, online banking, as was suggested before, where somebody could worry about financially impacting me versus somebody understanding I'm on certain medication. Right, so I think there's a certain fear out there, but I think once the medical, the HIPAA laws and other data privacy laws in each country are followed, I think the public should be, less concerned with that and more concerned with what they do with the data once they get it. There's a lot of market out there just for telematics. Telematics means who's taking the data, what age they are, who's using the data, is it working for that specific person, and that goes back to the insurance companies. Is that person taking the medicine, and then, before I reimburse it, is it actually working? So I agree with both my colleagues that, it's what they do with the data once it's there versus somebody breaking into my account and understanding what kind of medicine I'm on. I think that's more of the public here is what they do with what they do with the data versus somebody understanding what data I'm on, medication I'm on.
Yeah, that's true. I agree with you. I agree with you on that. We got here a question from the audience. We just received an email. People can email us questions for panels live, and we got here a question from one of the viewers asking the following: do you think that we will have devices that enable us to take vitals such as heart rate, blood pressure, and so on, without the need to physically touch the person himself? So, for example, I saw this very nice project that was done in MIT with a mirror, that when you look at the mirror, you can they're basically able to analyze your heart rate. That's a very medical takeoff on Snow White. So you can basically see your heart rate when you look at the mirror itself. So do you think what is the situation, the development of these kind of technologies? How do you see it? How do you see it today?
I don't think we have to wait for 2025 for that, by the way. These technologies exist. Think of the human being as a biochemical engine, an electromagnetic field. We have all this information around us. It's a question of the sensitivity of the devices collecting it. Japanese, maybe 10 years ago, they were working on installing stuff in the restrooms to measure the biovital signs. So, not touching the body or non-invasive diagnostic, it's already, a present thing. Making them for mass markets, consumers, being able to transmit the information, I think it's what we're talking about now. Mobility, Wi-Fi, 3G, 4G technologies, M2M, all these will set the infrastructure and the mass market for this kind of non-invasive testing. But I think the technology is already here.
Yes,
Well,
I'd have to agree with that.
I'll remember that whenever I'm going to go to a restroom in Japan. No, that's extremely scary what you said just now. I have a mental image now. Nupur, how do you see this? How do you see this advancement?
So there's a lot of interesting things, as Manuel said, already going on. I think I recently read about a startup where that is working on a pill that you swallow, and that wirelessly communicates with devices in your house and uploads your data directly based on what you're eating, how things are going. There's also very non-intrusive sensors that you wear, right? So there's a small Band-Aid strip right now that, again, another startup is working on that if you just wear it, it's constantly doing a lot of things, including, your various blood levels, just by a slight prick. And, there's no wires connected. So I think to make this more pervasive and to, gain more consumer adoption, you almost need stuff that's wireless, on some level non-intrusive and just easy to adopt, right? Versus actually physically remembering to go connect yourself to a machine. So I think the world is eventually evolving there, and I actually think, you either have gateways in your house or your cell phone will become the gateway that's communicating, back to the hospital hub. So I think we're already there at the beginning, and hopefully it'll only get more pervasive.
I just hope that no one's going to connect this field to Twitter, and then you're going to see all those status, very disturbing status messages. People like
Kfir is drinking too much coffee.
Yeah, exactly. We treated this, and people start to answer you on Twitter saying stop drinking so much Coke and things like that.
Yeah, well, it could be an interesting weight loss mechanism, right? Like if it constantly posted what you were eating, there's a lot of social pressure there to lose weight, so you never know.
Yeah. It will be the Instagram killer, a pill that does it automatically. Again, a mental image. Again, Richard, how do you see this technology advancement from your point of view?
Yeah, I mean, the technologies are there. As we mentioned before, it's whether it's being adopted into the normal business life. Patients seeing a mass market. It's a business case that are supported. Right now, it's who's funding it and how it's getting out there. So, from my eyes, I think it's down the road. There are companies that have these great products out there that we see, as you mentioned, the Japan and others, wristbands and things like that. But to be able to mass market that and get it out to the patients and to the public, that's a tough task by itself.
How do you see the future 13 years from now, when we're talking about the last nice aspects of the future? And I'm referring to technologies, medical technologies, that won't exist anymore. Those things that we all, tell our kids. We will tell to our kids, when I was going to the doctor at that and that, when I was young, when I was your age, son, things looked that way. And our kids will look at us and say, you're a strange old man, right? So what are the technologies that won't exist 13 years from now in the medical field, in your opinion, Nupur?
So the way I thought about this is almost, so rather than answering the question in terms of like what technologies will not exist, I think there'll hopefully be a whole systemic change that will allow a whole new bunch of technology. So the biggest issue that I personally see right now in telemedicine is the way the reimbursement model is set up and the way telemedicine isn't as natural as an in-person visit, because not everybody gets reimbursed for an encounter like that. So I think hopefully, 15 years from now when we are talking about doctor visits, it is as natural as just a video call or a remote consultation, or almost us not having to see the doctor as often as we do right now, right? And in terms of, I mean, the fact that you actually have to physically go somewhere to get your blood drawn, or you have to physically, go into the hospital as many times, and I think a lot of this comes down to the way, at least in the US and some other countries too, these visits are reimbursed, right? So hopefully we'll see a whole systemic shift into, accountable care organizations completely, and, us just everybody being paid for end result versus a pay-per-visit model, that exists in a lot of the US and, several other countries too. And I think inherent to that, we'll see a lot of changes in terms of how a hospital visit is, or even the necessity of a hospital visit. I still think encounters with doctors will happen. They just happen over various other mediums, such as, video and whatnot.
Manuel, what is your take?
I think many things will change. I'll start with the very simple one. When you walk in a doctor's office, I don't think the doctor will ask, why are you here? What's your ailment? Because he'll have already the data. Going a little bit deeper, I think a lot of the surgical procedures will disappear. Will be done through biochemistry, through prevention more than intervention. So because you'll have vital signs changes very quickly, you can intervene quickly. Basic cases, appendicitis, probably can be pre-treated and not lead to surgery. Also, the surgery techniques are changing. We see already the trend with laparoscopic techniques. I think the third one, I don't think will be a lot of standard pills we're going to take. I think the pills will be the medicine will be customized to our biological functions. So I think the pills in one way will not be generic like they are today, and second, they'll have the right dose, and they'll be probably prepared for us in a biochemical factory of some sort, which will deliver pills to Manuel only, right? So I see these changes coming as a result of farming up the data about ourselves. And I think we talked a little bit about all these trends today. So I foresee some of this changing. Definitely, I don't see the doctor saying, what's wrong with you, or I don't know you, and I need to consult you.
Richard, your point of view about this topic?
Sure. I mean, I believe, there'll be less brick and mortar facilities, meaning that, we're working with a kidney dialysis machine for the home to be developed, for instance, versus going to a clinic. I think you'll see a lot more vitals to be able to be captured from the home, and they won't have to they'll be able to transmit that data to a doctor through video conferencing at the home. The doctor could treat, see the vitals and everything else remotely. And I think that the need to go to a doctor physically will be less needed as it is today. So I think, to say I have a cold, I think you'll be able to, video conference your doctor and send him your vitals through whatever technology is there in the future, and he could treat you from the home versus having to physically go to a facility. And that's where we're seeing the changes coming. And as I mentioned before, for the kidney dialysis machine, where before it has to go in a facility, now to be able to do that home, change the quality of life, etc. We're seeing a little bit of that happening now. And then when you say just in general, I have a cold or I need to see a doctor or a general doctor, I think you'll have to go less to the doctor and you could be treated remotely.
Okay, we are supposed to. Thank you very much for that point. And we've all painted here a very interesting image of the future. We are closing to the end of the panel. So I have one question for you. Let's say that you have that a billionaire is coming to each and every one of you and giving you $100 million and telling you can get this $100 million only for developing the next big thing in telemedicine. The one thing, the one product, the one device, the one technology that will be the next big thing in telemedicine. What will it be? Nupur?
Interesting. So if I had a lot of money, I actually don't think I would develop a new device. I would use the money to standardize everything that's going on right now in telemedicine. So I think that we need a standard for video calling that everybody uses. We need standards that all these devices interoperate on. I would use all the money to make somehow to force the entire world on maybe at most 2 or 3 different EHR systems, not the 100 different ones that exist. Because I think the technology is there, right? And I don't think we should go ahead and develop like a new hub or a new gateway. I really think that's going to be your cell phone or your iPad or some sort of device that that we're already seeing and interacting with. I just think that the ecosystem is way too fragmented, and I would want to use the money somehow to lobby somebody to make video conferencing exactly the same way as cell phone calling is today, right? You just call a number and it should work, right? It should not be such that it's such a pain to set up. It should be it should be the standard, and the same thing would apply to every single peripheral devices. Everyone's talking on different technologies, different backhauls. And I think the moment it's standardized, the adoption of telemedicine would go high. I think the technology is there. I think the issue is more in the adoption and ease of use, because I think healthcare conventionally is slightly backward when it comes to technology adoption. And I think part of the reason is the mass fragmentation and lack of standards in this industry.
That's a great point, Nupur, especially because this is an event by IMTC, a standardization organization. Manuel, your one line of vision for what you're going to do with the 100 million, and we are not talking about Mexico and Tijuana.
Not in pesos. I think I'll split the 100 million in 3 pockets. One will be to integrate the technologies we have and probably create some small apps for Android or iOS. The second pocket, which will be, let's say, another 30 million, will be to create market trials and see what can be done. And the last one, I'll spend it to market it and change regulation around it, because one of the biggest impediments right now are that the insurance companies don't cover a lot of these technologies, a lot of these procedures we're talking about. So I think public education or marketing, depends on your taste for the word, it's necessary. So, and maybe I'll return you 5 million at the end.
Thanks. And Richard?
Yeah, I don't think it's one device or one product that I would do, but I definitely would look from a whole ecosystem of telemedicine. I think there's a lot of great devices out there that need help with clinical trials. Of course, there's people that don't have insurance, which would love to have the funding go to that. But the true standardization and integration of the technologies across the U.S. and in each individual country, I think, is what's lacking today. Standards is very much a question, right? You may have an EMR, but which EMR are you using, for instance? And that becomes a whole host of questions and issues that you have when you start launching a service. So to standardize, I think, would be important across the U.S. As well as internationally, but more importantly, to help clinical trials, to help these new products get out of the door, to help these companies that are startup companies that have great technologies but unfortunately can't get the funding to move it into the industry, I think is important. I think that's what's lacking today.
So we have 3 different efforts, very, very interesting ones. I'd like to thank you very, very, very much for being a part of this panel. We've painted a fascinating vision of the future. Some of it is some of it I'm not sure that I'm very happy about, or like having myself, walking into the doctor's office and immediately he knows exactly what's wrong with me, and just gives me a pill that was assigned to me specifically. However, I have to admit that I really like the idea that Manuel raised, that he will give me back some of the $100 million, this hypothetic $100 million that we talked about before. Thank you very much for spending the time with us. We're going to have an interactive book about the event, and we will also have some of the content of this panel on it. And we really hope that we will talk with you soon to continue exploring this fascinating field of telemedicine. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you, guys.